Hello everyone, this is Dr. Pinst again. Let us do a quick discussion on lupus nephritis. Okay, as we all know, there are 6 stages in it. Class 1 is minimal mesangial, then mesangial proliferative, focal, diffuse, membranous, and advanced sclerosing lupus nephritis. We'll see one by one. So, class 1 minimal mesangial lupus nephritis. Pathology here is there is immune complex deposition in the mesangium, but the glomeruli will be normal. Okay, patient will be asymptomatic. There won't be proteinuria or renal dysfunction. Prognosis here is excellent. It rarely progresses to the renal failure. Okay, class 2 it is mesangial proliferative lupus nephritis. As the name suggests, there is a mesangial cell proliferation here. With that, mesangial immune complex deposition will be there. Clinically, patient might present with mild hematuria and low grade proteinuria. Prognosis here also it's good. Progression is rare to renal failure. Next is class 3, that is focal lupus nephritis. In this, less than 50% glomerular affected. Okay, less than 50% has to be remembered, and there will be segmental or global lesions seen and crescents can be seen. Clinically, patient will be having hematuria, proteinuria, and nephrotic syndrome. Okay, prognosis is variable, requires treatment to prevent the progression. Next is diffuse lupus nephritis. In this, more than 50% of glomeruli are affected. Active lesions are seen and crescents are seen. Patient will be having same like hematuria, proteinuria, nephrotic syndrome, and renal dysfunction is seen here. And prognosis is poor without aggressive treatment. So there is a risk of end-stage renal disease. Next is fifth, that is membranous lupus nephritis. Here we see thickening of the glomerular basement membrane. Okay, due to immune complex deposition. So patient might present with nephrotic syndrome, normal or mild renal dysfunction will be there. Prognosis is variable. It can progress to end-stage renal disease if combined with proliferative changes. And the last, that is sixth stage, advanced sclerosing lupus nephritis, in which there is more than 90% glomeruli are sclerosed. So clinically, patient will have persistent renal failure, minimal response to the immunosuppressive therapy, and the prognosis is poor, and it leads to end-stage renal disease. So patient might have to put on dialysis. Okay, this is the picture of all the stages. Class 1, as I said, there is only immune complex deposition in the mesangium. Class 2 is there is a mesangial proliferation, and class 3 is focal, that is less than 50% of glomeruli are affected, with that crescents can be seen. Class 4 is diffuse, that is more than 50% of glomeruli is affected, with the crescents are seen. Class 5 is there is a thickening of the glomerular basement membrane, and class 6 is more than 90% of the glomerulus is sclerosed. Okay, so coming to the management, class 1 and 2 minimal immunosuppression is sufficient with supportive care, and class 3 and 4 aggressive immunosuppression therapy has to be given, like steroids, cyclophosphamide, and mycophenolate mofetil. Class 5 is steroids and MMF for nephrotic syndrome. Class 6 is supportive care, dialysis, or renal transplantation for the end-stage renal disease.